My name is Terry Chavez. I am the Senior Manager of Simulation for Banner Health. I have been in simulation for about three and a half years. I was hired to open up the Banner Simulation Medical Center, which is our 55,000 square foot virtual hospital. When we first opened, we were tasked with standardizing onboarding for Banner Health over, at that time, the 9 hospitals in the Phoenix area. So we built the curriculum. We came up with different topics for the RNs. I call them my domains. So with our new grads, we're actually looking at time management, priority setting, and communication. And we have a checklist that we can gather this data from our scenarios. Our scenarios, we started out with 4-hour scenarios. Our new grads have multiple patients with the scenarios going for 4 hours. We have now increased it to 6 hours. So basically, it's the day in the life of the nurse. We use the mannequins to help us get the nurses to think about what they would do next, but it's in a safe environment. Whatever happens in simulation stays in simulation. We actually like it when they make errors because then we're allowed to teach. Otherwise, we're just sitting there guiding them, and then we do the debriefing. So we do get to do some of the teaching, but we try and keep hands off and let them live by the mistakes so that when they leave us, they'll be able to deliver safe patient care. I had been an educator in critical care, and we used to take our critical care group to the simulation lab at Good Sam. So yes, I ran a code and I ran a heart failure scenario, but they were the typical 15 to 20 minute scenarios. So I had touched base, but that's what gave me the love for simulation when I realized how important simulation was and what you can learn from simulation versus just the typical case studies that we were doing with our new grads. You can't try and figure out what your outcomes are going to be. You have your objectives and you know what your goals are. So you just need to relax and let things happen. Big thing we always joke about is you never can have enough outlets. So 3 years ago, I would have fought for the outlets, okay? Your mannequins are high fidelity mannequins. They all need outlets. We try and use as much realism as possible. So I need the outlets for my PCA pumps, for my IV pumps, for all of that equipment that puts you into that realism, okay? You want to get to that suspension of disbelief. And it's not so much your scenario, a lot of it is what we call the moulage. So my advice to me would have been keep your moulage simple and concentrate on what your goals and outcomes are going to be.